أهلا بكل الذين ينضموا للاستماع إلى راديو بلدي أول راديو عربي أمريكي ويعنى بقضايا العرب في المهجر. برامجنا في راديو بلدي كل يوم جمعة من 8 وحتى 9 صباحا مع ليلى الحسيني في بث حي ومباشر عبر WNZK راديو 690 AM. صباح الخير بلدي، صباح الخير لكل مستمعينا.
Welcome to Radio Baladi, the first Arab, Middle Eastern and American simulcast radio show. Radio Baladi is broadcast every Friday morning on WNZK 690 AM from 8 until 9 Eastern Time on Good Morning Michigan with Layla Al-Husseini. Our call-in number 248-557-3300. And now, stay tuned for the best radio talk show on Arab and American issues with your host, Layla Al-Husseini.
Good morning and thank you for being with us. This is Khalil Hachem, editor via Michigan.com, the fastest growing digital business magazine in the Middle Eastern communities in Michigan. Thank you for being with us. Today is Friday, January 29th, 2021. I can't believe the month is already gone. It's very cold outside. It's about 13 degrees, where if you factor in the wind chill, it's in the single digit. Again, thank you for being with us. The number here is 248-557-3300. Give us a call if you have a comment, if you have a question in Arabic and English. We would love to hear from you. Excuse me. You know, it's January. We were promised by now we would have a good number of vaccines in our arms, but those numbers really have not materialized. They're not there. At the same time, you know, heroic efforts have gone into the development of the coronavirus vaccine. Yet some people are still hesitant to take the shot in their arms. Do you know enough about it? And what do we need to know to reassure us that we need to take it? Because we have to take it. There is no other way around it right now. And with us this morning is Dr. Joneigh Khaldun, Chief Director for Health and Human Services for the state of Michigan. Good morning, Dr. Khaldun.
Good morning. Thank you for having me on the show.
Absolutely. Thank you so much for being with us. And as I mentioned in the intro, this is something we need to do, and we don't have enough. What do we need to know about it, and when we're going to get it?
Absolutely. So it's important for everyone to know that these vaccines, the Pfizer vaccine and the Moderna vaccine, they are safe and they are effective. Both of them have been studied in tens of thousands of people. The technology used in these vaccines is old technology. Scientists have been using this messenger RNA technology for several years, which is why they were ready to develop these vaccines when the COVID pandemic hit us. So these vaccines are safe and effective. They are the way that we are going to end this pandemic. And it's important that everyone makes a plan for getting a vaccine when it becomes available to them.
Absolutely, and that's going to be the next question. How many have we distributed?
Yeah, we've distributed about 1.5 million vaccines across the state. All of those vaccines are either in an arm or they're scheduled to be in an arm, which is really, really important. We've been working with our providers across the state to make sure they are being efficient and as quick as possible in their vaccine delivery. We don't want any vaccines sitting in freezers. So it's really, really important that people work with their local health department. There are many hospitals that also have a lot of vaccine. There are pharmacies as well. So it's important that you can go to our website, michigan.gov/COVID vaccine, to get more information about when you can get your shot.
Okay. What's the distribution schedule?
Yeah, so we started in the middle of December with frontline healthcare workers and people who are working or living in long-term care facilities and nursing homes. We, a few weeks ago, moved forward with people who are over the age of 65, people who are working in facilities like jails or prisons or homeless shelters, and also our child care staff and our K-12 teachers. as we get more vaccine into the state and as we get more people in these groups vaccinated, we will be able to, hopefully as soon as possible, open up eligibility for other people, including people who are age 16 to 64 who may have underlying medical conditions like diabetes or high blood pressure.
Mm-hmm. You know, some people are hesitant because there has been, conflicting information from this scientific community because we didn't know much about the vaccine. What are we doing as a state to reassure people that this is safe, this is something that they need to take?
Yes, so we're really focused on that in the state. We are launching have already launched a multi-million-dollar campaign effort. So media, written material. We also today have our first meeting of our Protect Michigan Commission. Over 60 people, leaders across the state from multiple sectors, bipartisan, who are really going to be leading the charge when it comes to getting that information out about the vaccine into the community.
Is the vaccine free? Do we have to pay for it?
There's no out-of-pocket cost for anyone to be able to get this vaccine, which is really, really important. There's also no requirement for citizenship. We're not checking anyone for citizenship if they come to get a vaccine. So that's really, really important. We don't want there to be any barriers for people who are seeking a vaccine.
Sure. There's some people who reported that they've been asked to provide health insurance credentials before taking the vaccine.
Yes, that is correct. If you do have health insurance, the person who is the provider may bill that health insurance. So that is correct. But there should not be any co-pays or out-of-pocket costs when you go to get the vaccine.
What do we know about the new strain?
Yes, there are three new concerning strains of COVID-19 that have been identified in the United States. The B117 strain that originated in the UK is the one that we know there are at least about 20 cases in the state of Michigan, one of which is associated with an outbreak on a college campus. So the concerning thing about the variant is that it is more easily spread from person to person. And so what that means is if it is more easily spread, we will potentially have more cases, more hospitalizations, and deaths. So these strains are very, very concerning. There's two additional strains, one coming out of Brazil and the other one from South Africa. What's concerning about those, and it's particularly the one coming out of South Africa, is it looks like the vaccine may not be as effective against that particular strain. It will still give you some immunity, so it's still really, really important that people get these vaccines as quickly as possible. But we are concerned that the South African strain may not be as susceptible to the vaccine.
And what do we do in this situation? Are they going to readjust the vaccine or just do what we have to do?
So our researchers and scientists are working hard at this. Actually, Moderna and Pfizer have announced that they are working on potentially developing a booster shot for their vaccine. So the vaccines will still be effective. They may not be as effective against some of these variants, but it's also even more important. That's why we need to get this vaccine out as quickly as possible. The fewer people that get the virus, the less opportunity this virus will have to develop these mutations and to really threaten the progress we've made in the state. So that's why it's so important for people to get these vaccines. Sure.
Without getting too complicated in here, why do viruses mutate? Is it because they enter into people?
You know, that's a great question. Viruses have been mutating since the beginning of time. It's really just what they do. Sure. They spread from person to person, and they get smarter. And they try to hide from the body's defense mechanisms. And so that is what is expected. A lot of mutations don't have any difference on how severe the virus is or how it's transmitted. But the three ones that I named, it's concerning because it looks like the mutations in those viruses do impact how the virus spreads and potentially how well our vaccines work.
Absolutely. Now, having the vaccine does not mean we're going to relax our social distancing, wearing a mask, protecting ourselves. Is that correct?
That is correct. Even if you get the vaccine, you still have to wear a mask. The vaccine, we know it protects you from getting sick, but we still don't know if it prevents you from spreading it to other people. It likely does, but the data is still not clear on that, so it's still important that everyone wears a mask. And it's going to take a while. We need at least 70%, if not more, of people to be immune to the virus in order for us to be able to really relax all of our social distancing and mask wearing measures. So it's going to be important that people continue doing those very important things.
Absolutely, absolutely. Okay, I'm not 65. I don't have, other than being a journalist, I don't have any other qualifications. When will I get my vaccine?
So unfortunately, I don't have a date at this point. What I'm hopeful about is that we will get more vaccines into the state. We just learned from the federal government we will be getting 16% more of the Moderna vaccine in the state for the next 3 weeks. I'm hopeful that there are additional vaccines by different manufacturers that would potentially be coming online as early as February. So as we get more vaccines in the state, hopefully we'll be able to open up those eligibility groups.
Yeah. Is there anything I haven't asked you that people need to know?
I think everyone just needs to please make a plan to get the vaccine when it is available to you. And I recognize that there's simply not enough vaccine in the state for everyone who's currently eligible. So I ask that people also be patient as we work to get these vaccines administered as quickly as possible.
Thank you so much. We appreciate everything you do and you taking the time to be with us. We really appreciate it.
Thank you so much. Stay safe.
Thank you. We're going to take a short break. We'll be right back. Stay tuned.
Ziyad brand. Quality products from our family to yours. Ziyad Brothers Importing offers the finest quality products, including brands like Sultan, Kraft, Nestle, Hook, Rico Picon, Donna, and many more. Ask your retailer to carry these fine products because you deserve the very best. For more information, visit our website at www.ziyad.com. That's www.ziyad.com. Ziyad, quality products from our family to yours.
Are you going to start a restaurant or grocery store soon? Do you need floor plans and designs? Call Najee Abood at 734-744-9796. Do you want to buy kitchen and restaurant equipment at discount prices? Call Najee Abood now, 734-744-9796. New Concept Products and Design, the trademark of kitchen equipment. 5% discount on all purchases of $75,000 or more. New Concept Products and Design, new location, 31185 Schoolcraft in Livonia. Learn more at www.newconceptproducts.com. Call Najee Abood, 734-744-9796.
Life is a nonprofit charity that's provided humanitarian aid and development to people and communities for over 25 years, regardless of race, color, religion, or cultural background. When disaster occurs here or around the world, Life for Relief and Development rushes in to provide food, medical aid, and shelter to those in need. Please help improve these efforts. Make your tax-deductible donation to Life now at lifeusa.org or call 248-424-7493. Get ready for an amazing experience at Ishtar Restaurant on 15 Mile Road in Sterling Heights. Enjoy excellent hospitality from owners Ali Al-Baghdadi and Fatty Bonham, serving the best in Mediterranean food. Try Chef Ali Al-Baghdadi's famous shawarma, the best Iraqi grills and food, and the best Arabic and international dishes. Dine in our authentic atmosphere or take out. Call 586-698-2585 or check us out on Facebook. Ishtar Restaurant practices all CDC guidelines and is open every day 11 a.m. to 10 p.m. Have an amazing experience today at Ishtar Restaurant, 3625 15 Mile Road, Sterling Heights.
Welcome back and thank you for being with us. We really appreciate your time and your attention. Here at US Arab Radio, we try to bring you as much information as possible to help you make good decisions. The vaccine is a personal issue. And also it is a public issue. And here's why. we will never push something on you that you really don't want. We just try to explain it to you so you can make the right decision. It is a personal issue because some people believe that they should take the vaccine. Some people believe they don't want to take the vaccine. They have strong feelings about it for either personal, for social, whatever reasons that they have. Now, the hesitancy has been is that the way these vaccines have been developed using certain technology that is new for vaccines. It's not new for medicine, but it's new for vaccines. And it has been done in a way that it was an emergency authorizations by the government. Now, before all of that, there has been a movement against vaccines, whether it's in the U.S. or in the other countries. In general, vaccines works. Vaccines work. They do work. You know, whether it is for polio, whether it is for anything else, vaccines work. And I know some people may have reservations about them, and there are all these theories and conspiracies about, different people want to control the world. It doesn't work out that way. These conspiracies are not there. There is a valid concern about the new technology, and we're all looking for information to make the right decision, okay, including myself. I'm still gathering information. I'm going to take the vaccine, but at the same time, I want to learn more. I want to talk to more people who have taken it, how is it affecting them, and what is the long-term effect on that as well. So it is a personal issue, and talk to your health provider. Make sure you're making the right decision. Don't listen to all of this mumble-jumble stuff that you hear on social media. I get it. People send it to me. Most of it is inaccurate. Most of it. 99% of it is not accurate. So be careful. Okay? Don't be a prey for somebody else's ignorance. And today, with the click of a button, we send information to everybody. We don't even know whether it's accurate or not. Okay, I'm going to talk more about that later on in the program. And so it's very important that you get the right information and you make the right decision for you and your family. Coronavirus is serious, and we're not out of the woods yet. We still have a lot to deal with. New strains, different things, and how it is going to affect our pockets, how it's going to affect our jobs, and how it is going to affect our economy and our future and our children. Okay, a lot of people are dying from this. So make the right decisions. Anyway, we'll talk more about it later on. Now I'm going to turn into a different issue. There has been some history made in Dearborn Heights this past week. Excuse me. We have the first Arab American mayor of the city, and then we have two people have been appointed to the council. We already had Dave Abdallah being on the council as well. We've had Arab Americans serving on the council before, but this is totally different because we have, three people were appointed this week to the council. One of the people who have been appointed to the council is with us this morning. This person has been one of the hardest working public official, even though he was not elected in the city of Dearborn Heights, and that's Zouher Abelhak. Good morning, Zouher.
Good morning, Haj Khalil. How are you?
Good. How are you? And thank you so much for taking the time to be with us.
Thank you for inviting me. Thank you very much.
Absolutely. And congratulations. This is a great appointment. How do you feel and what do you hope to accomplish?
Well, I feel good about what happened on Tuesday night. It was history to have, all these appointments happen within an hour. And I hope to accomplish what I have been advocating for. First review of the Charter of Dearborn Heights, which is over probably 60 years old, 57 years old, never been reviewed, and to accomplish the forensic audit, to finish the forensic audit, which I started and advocated for. Those are my two principal goals. After that, I would like to see how we can improve the services for our residents and see if we can tackle the issue of the flood in the south end of Dearborn Heights. Those are the issues really which are pressing more than anything.
Yeah. What's the forensic audit? If you wanna tell us a little bit more about it.
We felt that God rest his soul, late Mayor Palatko, who passed on the 29th of December, misused some of the restricted funds. Some of it, the taxpayers paid for a specific job. He used it for something else. And he overcharged the residents $6.8 million over the years on projects and bonds which were paid in 2009, and he kept charging the public until 2015. So we need to know where the city stands financially.
Okay. Absolutely. And when it comes to services, are we going to see anything different? This is a complete change. I mean, we have 3 new people taking different positions. Well, 4 actually, because Dave Abdullah would be a pro tem. Is that correct?
Yeah, he took the pro tem.
Okay.
And Bill Bazzi, I trust him very much. He's a 21 years Marine. He works for Ford Motor Company, has master's degree in aeronautic engineering. He's been around, for a long time. And he is not afraid to make the hard decisions. Yeah. And I believe he's going to sit with the heads of departments one by one and with the city council one by one and see how we can improve things in the city, because it's time to move forward and to put all the pickering behind us. That's what we're going, to be working towards.
Absolutely. It's a good city, and I think residents are really blessed to have you guys, being on board.
Yeah, Mo Baydoun has been around too. He was appointed to city council too. He's young, energetic, and I have hope for a bright future for him more than just city council.
Absolutely.
We have a great group on the city council. Hopefully, they will work together. They will put the interest of the residents in the city ahead of everything. And we have a vision for the city. Unfortunately, for the last 15 years, it didn't move any way forward except the new houses and new buildings. But we have the Warren Valley Golf Course. That is a great project. If we do it right, it will bring great money for the city and for the area. So there are lots of projects. We will work on it hand by hand with the heads of department, the employees, and the elected officials. The city must move forward, and everybody must work together. Otherwise, we're going to be in the same boat, like we were for the last 15 years.
Absolutely. And cities are going to be facing more challenges down the road because of the lack of funds. Services are getting more expensive, and then, the money is coming in is going to be shorter and shorter, and then you cannot dump that on taxpayers. And I know you share those thoughts as well.
The city is a great city. It's a safe city. There is lots of opportunity, for people to come and invest in it. The services will improve. Definitely, they will improve. And the taxes in Dearborn Heights are not as high as other cities around us.
No.
The schools are really very good schools. And it's a family-oriented city. It's not, we don't have huge companies or anything big. It's really, if you want to grow a family and you want safe place for your children, Dearborn Heights is the place.
Absolutely, absolutely. And this is something maybe you need to look into as a council. Successful cities are cities that have a good mix between commercial and residential. And the more commercial you have, the better for you as a city, because commercials generate more funds than residential. This is something maybe you need to look into, down the road.
We are looking at basically the south end, the Van Born corridor and Telegraph. This is a place where really investors can put their money in and can make a great profit in very fast time. And I invite all our people who are listening to us and they want to invest in projects where they can really have good return on their money to come and look at the properties on Van Born, and they can buy it with very, very, very good price. And if they renovate it and they do something there, I think they will make a success of that area. Yeah. It's going to take more than that. It's going to take a vision from the city to make it into some kind of a business development area, and hopefully, and you mentioned this, that it'll be easier to work with the city as far as investors working with the city to develop that. You need mayor who has a vision, city council who share that vision, and you need the fund. But anybody who comes to invest in any city has, they want a safer place. They want to make sure that things will give them a good return on their investment. All these things we are working, on them for a long time, but unfortunately nothing was moving before. Hopefully, Bill Bazzi has the vision and has the guts to make the hard decisions, and I believe our city will change drastically, and the residents and the people will see that those changes are happening very, very soon.
We have faith that you guys are going to do great, and it's a great opportunity. Congratulations. And I want to thank you so much for taking the time to be with us this morning, Zouher.
Thank you, and thank you for inviting me, and have a blessed Friday.
You too. We're going to take a short break. We'll be right back. Stay tuned.
When it comes to reproductive medicine, IVF Michigan Fertility Centers are the recognized leaders. With locations in Bloomfield Hills and 5 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. As a founding member of IVF Michigan Fertility Centers, Dr. Nicholas Shama is one of the leading reproductive endocrinologists in Michigan and Ohio. Dr. Shama has performed over 10,000 IVF cases and has helped thousands of couples fulfill their dreams of parenthood. American board certified in both obstetrics and gynecology and reproductive endocrinology and infertility, Dr. Nicholas Shama is a very caring, compassionate, expert physician that understands not only the medical but also the emotional toil of infertility on his patients. When it's time, get personalized care from Dr. Nicholas Shama at IVF Michigan Fertility Centers in Michigan and Ohio. Call toll-free 855-952-9600, 855-952-9600. Enjoy the first Syrian-style cuisine in Michigan. At Damas Cuisine and Catering, you'll find a wide selection of Syrian foods and sweets in our menu, like frike, hoizi, grape leaves with steak, mashawi platter, hot mahashi, char-grilled kebab, shawarma, and much more. Get super fast delivery from Damas Cuisine and Catering right to your door. Order online at damascuisine.com/menu and track your order live. Damas Cuisine and Catering, 28841 Orchard Lake Road in Farmington Hills. Call 248-987-4985.
When you're looking for the best in optical care, Dr. Imad Nakash is your doctor to see. With years of experience and thousands of successful procedures performed, you can trust your eyes to Dr. Imad Nakash. See Dr. Imad Nakash and his professional staff for your eye care needs. There's 2 locations to serve you. In Hazel Park, call 248-336-3937. 248-336-3937. In Rochester Hills, call 248-299-3937. That's 248-299-3937.
Welcome back, and thank you for being with us. we've been talking about the vaccine. We talked also about the city of Dearborn Heights and the changes there. And these are positive changes. Hopefully that the new group of people on the council will guide that city into a better future. All cities are facing, challenges, specifically fiscal challenges, because of the cost of services and the delivery, and then the taxes that they are levying on the property tax, that is, they are levying on the residents. Hopefully that they will work together. Now we're going to shift to a different topic, a little bit more national, international, and that is, the topic of the changes in Washington and how they're going to affect the Middle East. Most of us were not happy with what the Trump administration was doing in regard to the Middle East, specifically to the Palestinian issue. I don't care what everybody does in the Middle East. If they don't solve the Palestinian issue, really they haven't really solved the main problem. In the past, Israel has tried to distract us from the main issue in the Middle East, and that is, it's not the main conflict. The conflict is different, so forth and so on, but remains the main issue in the Middle East is the Palestinian issue and giving Palestinians a homeland and self-determination and so forth and so on. So we're hoping that there are going to be some changes in Washington right now, and we saw some. And to talk more about that, we invited our friend, Dr. Khalil Jahshan, Executive Director of the Arab Center, Washington, D.C., and a political analyst. Good morning, Doctor.
Good morning, Khalil. How are you?
Good. How are you? Did I pronounce your name correctly?
You did. Thank you.
Thank you so much. So when it comes to the past 4 years, what happened during 4 years? What are the changes, and where are we going from here?
I think the past 4 years have been quite damaging to U.S. Interest in the region. The previous administration, the Trump administration, has pursued a foreign policy that is not in harmony with conventional U.S. national interest, and not with the precedent, if you will. The policy usually doesn't change overnight, and the administration over the past 4 years chose to pursue policies that are unique to itself in a way. They did not abide by international law. They did not abide by American precedent in the past, regardless of what these previous administrations on a bipartisan basis, Republicans and Democrats alike, pursued, over the past 70 years. Thus, a lot of damage has been done to policy in the region, setting back the prospects for not just serving U.S. interests, but serving the cause of peace and stability in the region. And that burden was passed on to the current administration, which is trying in its first month in office, is trying to basically recover from that period and chart a new course, if you will, of restoring some sense of stability to U.S. policy.
What changes have we seen so far in the first week or 2 weeks of the Biden administration?
Of course, so far we have seen essentially just few symbolic steps that signal that the administration is serious about reassessing the policies of the past 4 years. They have made some important statements here in Washington and in New York at the UN Security Council debate on the Middle East the past few days. Basically saying that all the commitments made recently, particularly the last few months of the previous administration, are being reassessed. That includes, the agreements that the U.S. touted, the Trump administration touted as or called the Abraham Accords agreements normalizing relations between Israel and certain Arab countries. and involving all kinds of deals, some publicized, some not so publicized, and that's why the administration is looking into the detail, mostly with regards to arms sales in return for this normalization, which is not wise, ill-timed, and contributes to actually worsening the situation in the region. So we have seen some statements about Palestine, in addition, as probably your listeners are fully aware of. Essentially, the administration has declared its intention to resume relations with the Palestinians, to resume aid to the Palestinians, and to pursue an open relationship with them at this time.
Absolutely. The replacement of Secretary of State Blinken with, the new Secretary of State Blinken, who replaced Pompeo, who is a right-wing extremist, as we all know. I think that's gonna hopefully bring in any changes to the formula.
I think so. We're already beginning to see some significant changes, even though it's, we're just 9 days from inauguration. But definitely the appointment of a professional, well-experienced diplomat, respected worldwide, under the current administration, Tony Blinken, is represents sea change from the disaster that we've had over the past few years, and under Pompeo. So the arrogant diktat type of policies we got accustomed to under Pompeo, one-sided extremist approach is over. Now we're talking about resuming coordination with allies, reviving the quartet, beginning to consult with people both at home and abroad before we embark on adventurous policies in the region. So there is this sense of confidence, even though we are still at a very early stage. There seems to be some confidence that U.S. policy in the Middle East is about to make a turn for the better. It's about to become a bit more rational than we have seen in the past. It doesn't mean that miraculously everything is going to be rosy and perfect. There are many challenges that we face, including when we say, let's say, restoring aid to the Palestinians, when we say reopening the PLO mission in Washington. These are great steps and needed. However, there are legal impediments in the way of that. So whether the administration will have the peace of mind, considering the coronavirus and all that pandemic and issues, domestic issues, the economy, whether the administration will have the peace of mind to pursue that fully and implement these symbolic announcements thus far remains to be seen. But I'm one of those who tend to be optimistic, particularly in light also of some important appointments in key positions pertaining to U.S. policy. That is rare, where Arab Americans have been chosen or appointed in key policy-making decisions, both at state and at the White House itself, at the National Security Council. It's good to see some members of our community now involved in the policy-making.
That's really a welcome change. Now, at the same time, what do Palestinians need to do to really take advantage of this and get more benefit out of this?
The Palestinians need to do a lot, frankly. I think the future of Palestine, the cause of Palestine, is really in the hands of Palestinians. It's not in the hands of Israelis, and it's not, as far as I'm concerned, and it's not in the hands of the United States, for that matter. It's a Palestinian internal matter. The future of Palestine is a function of the will of the Palestinian people. So what needs to be done real quickly now, after this 4 years of disaster and paralysis as a result of U.S. Very biased policies in the region, the Palestinians quickly need to reassess all kinds of policies and practices First, they need to really take seriously the issue of internal reconciliation between the different factions. They need to probably begin to think seriously about moving away from factional politics toward democratic politics. And in that context, I think they need to take seriously the upcoming elections that have been announced and are underway right now. So we will be seeing 3 elections, presidential, we'll be seeing some legislative elections, and we will be seeing some local elections and also some changes within the PLO itself. That has to be taken seriously. This is a crucial moment in Palestinian history, and unless not only the Palestinian leadership, but the Palestinian people rise up to the occasion, I think the Palestinian cause continue to be in this state of flux, state of limbo, going nowhere, as we have seen the past 4 years.
Yeah, and that has hurt the Palestinians more than anything else.
Definitely, and it's easy for the victims of the Palestine cause to basically kind of give up and assume that rescue is coming from somewhere. International community, the United Nations, the U.S. I think in the final analysis, there seems to be an underestimation on the part of Palestinians, both leadership and public, of their own role, of their own impact on their own future, and they need to take matters finally into their own hands. This is a unique opportunity that might not repeat itself in the future, and they need to take full advantage of it.
Absolutely. Israel has succeeded in changing the focus of conflict in the Middle East from Arab-Israeli conflict, centered around the Palestinians, into, convincing some Arab states that I'm not your enemy, it's Iran your enemy. Now we have a different, regional conflicts between Israel and Iran, and then and how all of the people that align to that. How could the Palestinians refocus Arabs onto listen, the main issue here is Palestine. The main issue is, we're not saying let's go to war, but the main issue here is Palestine, is not Iran.
Yeah, this is a serious challenge because you're referring here to Palestinian-Arab relations, which have undergone some deterioration over the past few years. Result actually going back even a bit deeper. This whole business of shedding, if you will, Arab control over the Palestine issue, which became known in Palestinian political jargon as the independence of Palestinian decision-making, استقلالية القرار الفلسطيني. This was a myth in a way, and ended up, frankly, creating a gap between Arab national interests and Palestinian national interests if the two are separate. That was unwise, and that policy kind of failed. So the Palestinians are not that desperate in terms of their relationship with the Arabs. Definitely certain countries are seeking to kind of impose their will at this stage on the Palestinians, and they essentially displaying an element of Palestine fatigue, Palestine support fatigue, as we see in, let's say, UAE policy, or some other Gulf countries, showing us a bit of a distance from their support traditionally for Palestine. But frankly, the Palestinians have the winning card, which is public opinion. In research we have been doing over the past 7 years, a majority of Arabs throughout the Arab world, we do these surveys annually in 12 Arab countries. The last survey we did this past year shows that in some countries, let's say like Algeria, which was the highest, 98% of the people do not want to normalize with Israel and continue to believe that Palestine is their cause, and that remains to kind of beg for an answer or for a solution. Even in the Emirates and in Saudi Arabia, the numbers are close to between 60 and 70% of the public that do not want to normalize with Israel until the Palestine problem is solved in a just and equitable and long-term solution. Then we will look at that relationship. So the public is way ahead of the governments. And that's where the challenge is for the Palestinians, how to reconnect with Arab publics and work with them constructively to basically impact and influence their respective countries' foreign policies with regards to the Palestine issue.
Sounds good. We have Jerry. Jerry Habba is on the line. Good morning, Jerry.
Good morning, Mr. Khalil. Thank you for taking my call, and good morning to your guest, Doctor. Doctor, my question is, Iran has a lot of influence in Iraq, in Iran, Syria and Yemen. I do believe those three countries, they suffer a lot because the Islamic Republic of Iran put a lot of interfere in those countries, and those countries right now, we could say in Arabic, al-bunya al-tahtiyya tahattamat.
What's the question, Jerry?
My question is, Doctor, is the new Joseph Biden administration will take a different policy or dialogue to deal with this matter with the Republic of Iran to stop the influence? And from the other side, the second part of the question, Turkey has a lot of involvement in Libya. So I would love the doctor to respond to that. And thank you very much. And thank you, Mr. Khalil Hachem.
Yeah, absolutely. It's interesting, Jerry, that you ask about Iran interference. You don't ask about Israeli interference. Go ahead, Doctor.
Yeah, look, Iran's relationship with its Arab neighbors have been very problematic. A lot of interventions in a negative sense. As you said, there are several Arab countries, at least three, that are almost dominated by Iranian influence. And that is a harmful relationship, not just to these countries specifically, but to the bilateral relationship between Iran as a regional power and the rest of the Gulf, particularly and the Arab world. And this has been manipulated, as Khalil said earlier, manipulated by the Israelis to distort the whole conflict, to try to rally Arab countries against Iran as if it's the only enemy, while ignoring totally Israel and Palestine. I think this administration has a better perspective. First of all, it is trying to correct the mistake committed by the previous administration with regard to the nuclear agreement of 2015 that the Trump administration withdrew from. I think that was a big mistake because that was an effective way negotiated by the Obama administration to limit the nuclear power and the continued regional troublemaking, if you will, by Iran. But it was never given a chance, and Trump chose to kind of withdraw from this for ideological reasons. Now it looks like there might be a resumption of negotiating a return to that and maybe amending it, if you will, for the better. Amending it for the better includes those issues that Jerry just referred to, relationship with neighbors. Because that's what the neighbors are complaining about. They could care less about Iran nuclear because they don't see the nuclear threat as against them in Saudi Arabia or in Bahrain or in UAE, but they see their daily troublemaking in these countries, particularly the ones that Jerry referred to, like Yemen and Syria and so on. They see that as problematic. So that will have to be part of the new set of negotiations that we're about to embark on.
One thing, though, out of fairness, all nations behave according to their interest. The whole world is interfering in the Middle East, and singling out one country is not going to really take us into any resolution except widening the gulf between these two countries. Isn't it time that this administration has taken a look at more comprehensive about interference in the affairs, whether it is Iraq, Syria. I mean, look how many countries are in Syria. The Russians in Syria, the United States illegally in Syria. And then you have, 50, maybe 100 different nationalities fighting on behalf of the Muslim extremists in Syria. And we don't want to see any of them. We only want to single out Iran. Is that fair?
I think it is, and some very smart analysts, including, for example, I just throw a name in as Stephen Wertheimer this morning in foreign policy, as a very interesting challenge to the country. He is trying to say that, look, the problem is much larger in terms of foreign policy than just one area or the other, the Middle East or Russia or Iran or what have you. The problem is the U.S. has to reconcile its pursuit of national interest versus its pursuit of domination. And there is definitely a big difference. And that is a debate that's taking place right now at the highest levels. And this is important time to influence during restructuring or reassessing. That's the best time to influence policy of any country. Yes, foreign policy is based on national interest, but also national interest has to take or to be concerned about long-term impact, about the opinions of the other side, and so on, to be effective and to be lasting. Otherwise, we will be changing policies every 5 minutes, like the weather in London. And so that's what the U.S. today is paying a price for a lot of mishandling that took place over the past 50, 60, 70 years. Yeah.
Absolutely. You know, I mean, I don't expect the Biden administration to take a stand on Israel annexations of the Golan Heights. I mean, the Golan Heights is Syrian territory. Everybody knows that. International law dictates that it is Syrian territory. And then Israel annexed that, and with the blessing of the Trump administration. But I don't expect that the Biden administration to really revisit that issue. What do you think?
I think it will, Khalil. I think it will at the right time. It probably is premature to engage in internal war over this issue right now, mostly because of the situation in Syria. The fact that if there was a different regime in Damascus, a democratic government, if you will, that's open to serious negotiations and to settling the civil war inside Syria, the administration would be moving a lot quicker in this respect. But it will because, frankly, this administration, I think, is much more committed to international law and much more committed to conventional politics at the international level, particularly in coordination with allies, EU, and even Arab allies, for that matter, than the previous administration. So eventually it will have to deal with this issue, yes.
Sounds good. Well, I want to thank you so much for taking the time to be with us. I hope that we have helped our listeners understand this complex issue, and then we wish the new administration best of luck. 30 seconds, last words, Dr. Jahshan.
Thank you very much. I appreciate your invitation to join you. Greetings, good day to all your audience, and please stay safe. Thanks.
Thank you so much. Really appreciate you being with us. We're going to take a short break.
My pleasure.
Stay tuned.
Are your hands feeling numb? Do you feel pain opening up a jar, turning a key? Are you noticing that your elbow and your shoulder are becoming stiff? Or were you recently injured in your arm? Hello, I'm Dr. Al-Majid Katranji, and at the Katranji Hand Center, which just recently opened down the street from the Somerset Mall, we can provide you with the latest in hand, wrist, elbow, and shoulder care. Visit us at www.katranjihandcenter.com to learn the latest techniques that we have to offer you, and I look forward to taking care of you.
Visit us in Troy at 1565 West Big Beaver Road, Building F, or call Katranji Hand Center for an appointment at 248-869-4263. That's 248-869-4263.
Kushat's Mediterranean Market and Shish Kebab offers a great array of your favorite Mediterranean meals. Meals range from lamb specialties, shawarma sandwiches, seafood dinners, and they offer special big trays of your favorite food, plus much more. Kushat's Mediterranean Market and Shish Kebab address is 32839 Northwestern Highway in Farmington Hills. Their phone number is 248-538-9552. That number again is 248-538-9552, and the supermarket is open from 8 a.m. to 9 p.m. Kushat's Mediterranean Market and Shish Kebab will definitely leave you satisfied.
At Top Rehab Physical Therapy Clinic in Dearborn, we provide effective physical therapy sessions in order to limit pain and discomfort. Top Rehab provides physical therapy care for any diagnosis prescribed by a physician, and we regularly see and treat conditions such as stroke, TMJ, fibromyalgia, sciatica, joint pain, and more. We use a variety of pain management methods, including modalities, soft tissue mobilization, and therapeutic exercise. If you're in need of physical rehabilitation or physical therapy, get the highest quality health care at Top Rehab. Most insurance is accepted, and we're open Monday, Wednesday, and Friday 8 to 6, Tuesday and Thursday 8 to 5, and Saturday 10 till 2. Call for an appointment today at 313-846-0555. That's 313-846-0555. Choose Top Rehab Physical Therapy Clinic on Michigan Avenue in Dearborn. Life's too short to be in pain.
Thank you so much for being with us, and welcome back. You know, we were talking about different issues from the beginning. We talked about the vaccine. I want to thank Dr. Khaldun for taking the time to be with us. We talked about the changes in Dearborn Heights, and also want to thank Zouher Abelhak, council member Zouher Abelhak, for being with us. You know, Zouher has been a very active member of the community there. He has the city's really best interests at heart, and he's been asking for a lot of issues to be out in the open, and hopefully they will be out in the open. Bill Bazzi is a good man who is going to guide that city into really a better place. He's the mayor, Bill Bazzi, and you know, the rest of the council. You know, cities work well when everybody is working together, and they know where they're going, and then they're in sync with the citizens and the growth in the city and whatever is happening in that city. Also in sync with what's happening in Lansing and in Washington because of funding. This is a little bit more complicated. The story about how cities survive and don't survive, maybe we can just do a segment on that later on. I want to thank Dr. Khalil Jahshan for being with us, talking about the Middle East and the changes, hopefully, in the Middle East and what needs to happen in the Middle East. And hopefully, you know, we could use his expertise and hopefully they would listen to what he was trying to tell us this morning, which is, you know, we hope that it will happen, that the Palestinians will work together, they would refocus their attention on their issue, and they refocus the Arab attention on the issue of solving the Palestinian problem, and so they can have better life for themselves and for their children and for the future in that area, living in peace, everybody living in peace there. The last word that I want to share with you, and that is the vaccine. It's a personal, it's a personal decision. We hope that you consider learning as much as possible. We're going to tell you about our commitment at US Arab Radio and at Michigan US Arab Radio is to provide you as much information as possible so you can make a good decision. And we are learning every day. It's a new virus. It's a new vaccine. Everything is new. Nobody has all the answers. We're trying to do our best. And you make better decisions if you have all the information, and that's our commitment to you. I want to thank Layla Al-Husni for her commitment to provide that information. And we promise you that we're going to do that. Thank you so much. Thank you, Mike, for a great production. And thanks to all of you for listening. Thank you, Jerry, for calling. Have a wonderful, wonderful weekend. Bye now.